Can exercise prevent the risk of diabetes? I'm Dr. Nadeem Sajjad Raja. The global rise in type 2 diabetes has become a significant public health concern. According to the WHO, type 2 diabetes currently affects more than 6% adults worldwide. And this figure is projected to increase nearly 7% by 2030. Just in 5 years' time, more people will be suffering with diabetes. Encouragingly, the WHO states that the risk of developing type 2 diabetes is largely preventable. That is a good news. Key preventable strategies include maintaining a healthy body weight and engaging in regular physical activity or exercise. Taking such measures, particularly when early signs of diabetes, such as elevated blood sugar levels, are present, can substantially reduce the risk of progression to full-blown diabetes. So raised blood sugar level is also called as pre-diabetic stage. A recent study published in Cardiovascular Diabetology Endocrinology states that further weight to growing body of evidence supporting the role of exercise in diabetes prevention. So it also adds that reducing weight, exercise is very important in diabetes prevention. This study found that individuals with pre-diabetes, so defined as having elevated blood glucose level, not yet high enough for a diabetes diagnosis, who engaged in more than 2 hours of exercise per week, significantly lower their risk of developing type 2 diabetes. Diabetes profoundly impacts on our health. It increases the risk of virtually every major disease, including heart diseases, stroke, kidney failure, vascular diseases, blindness, and serious infections, I would say repeated infections. These complications often lead to premature death and significantly reduce the quality of life of patients living with diabetes. Individuals with pre-diabetes may not face an immediate threat from these conditions. Their raised blood sugar levels serve as an early warning sign. We know that between 25 and 50% of people with pre-diabetes will develop full-blown type 2 diabetes. That is why it is prudent to take preventive measures as soon as the warning signs appear. Regular physical activity, just couple of hours each week can make a meaningful difference in preventing type 2 diabetes, especially in those at increased risk of developing full-blown diabetes. Promoting such lifestyle changes remains one of the most effective, cheap, and accessible strategies in combating the global diabetes epidemic. Thank you very much for watching this video.